Hi, everyone. This is Mayor Nic Hunter. I'm filming this about 2:45 p.m. on Monday, July 26th. And I wanted to give a quick update to the community on COVID-19, specifically talk a little bit about the Delta variant and the vaccine, which has had a lot of conversation as of late. But as I've said before, I do think that when we talk about these issues, it's important for people to hear from local medical officials. And that's why I've asked a couple of gentlemen to join me. These are men that I trust. These are men that live, worship, work here in our area. Joining me today is Dr. Tim Haman, the Chief Medical Officer of CHRISTUS Southwest, and also Dr. Manley Jordan, the Chief Medical Officer of Lake Charles Memorial Health. Dr. Hammond, do you mind just a quick introduction, maybe a little bit about your background, your current position?
Sure. Tim Hammond. I'm originally from Moss Bluff, grew up there. I did my medical school at LSU in New Orleans, and then did an internal medicine residency at the University of Texas, and then came back and did an infectious diseases fellowship at LSU in New Orleans. I've been back home going on 9 years now. And as you said, I'm the Chief Medical Officer for our health system here. I've been doing that since 2016. So happy to be involved. I was born here, actually born a couple of floors up here at St. Patrick, and I'm happy to be back home serving the community.
Thank you, Dr. Hammond. And Dr. Jordan, same to you.
Yes, Mayor. Good afternoon, everybody. I'm Manley Jordan. I'm originally from Northeast Louisiana. I went to medical school in Shreveport, where I did my internal medicine residency, followed by a pulmonary critical care fellowship. Then I went to private practice in East Tennessee for about 15 years, and I came back to Louisiana. I came back to Lake Charles in 2004, was in private practice until 2016, just like Dr. Hammond, but became the Chief Medical Officer in 2016. So again, happy to be back and talking. I'm sorry we're still talking about COVID though.
I know, gentlemen, and I know that there's a lot of probably the vast majority of this community that this is the last thing anybody wants to be talking about. But I've often said I really don't think I'm doing my job as mayor if I'm not communicating with people about the situation that's out there. And let's get right into it. Dr. Jordan, what's the situation right now at the hospital with COVID patients? And can you specifically comment a little bit about what you're seeing with the Delta variant?
Yes, sir. So Louisiana and Southwest Louisiana are experiencing the fourth surge of the pandemic. You know, the first three surges were last year in April, July, and then starting in November. And Louisiana, the hospitalization for COVID has really quadrupled since July 1. Locally, and certainly Tim can speak to this as far as CHRISTUS, I know that Memorial, we tripled our hospitalization volume over the last 4 days. We went from 10 patients hospitalized with COVID to 30 just over the weekend. The biggest and most disturbing change is the age demographics, Mayor. We are seeing a much younger demographic. We've got probably 6 patients under the age of 30 in the hospital right now. A total of about 13 of the 30 are under the age of 50. So a much younger demographic, still patients on ventilators. So this Delta variant is what we're seeing is something that's much more transmissible, highly infectious, and also, and Dr. Hammond can probably speak to this better than I, that there's a higher viral load in the body. There's more of the bacteria or more of the virus in the body. So as these mutations continue to evolve, we're going to continue to see variants that are more and more concerning.
And Dr. Jordan, just want to reaffirm, I've asked in the past, a typical flu season or what we would typically see from other types of viruses or diseases, the impact on the hospital has certainly been greater with COVID-19 and with the Delta variant than you typically would see with other diseases or viruses, correct?
Yes, sir. It has much more of a strain on the healthcare delivery system. You know, I remember last year, and we don't want to go back to last year, during July, where we were, the healthcare delivery system was strained to the point that we have to have federal assistance. We had 3 DMAT teams, disaster medical assistant teams, in Calcasieu Parish because of our resources being strained so much. And just want to remind everybody, when we talk about resources, we're talking about more about the human element, the nurses, the doctors, the technicians at the bedside. Certainly PPE and beds and ventilators are all resources, but what worries us the most is the human element and the strains placed on the human element.
Thank you, Dr. Jordan. And again, I just think it's so important that we all understand when we talk about COVID-19 and the possibility of overloading or overrunning our hospital capacity, that does not only affect COVID-19 patients. That affects anyone that has a stroke or a car accident, and it's just not a good thing for our hospitals to be overrun or overwhelmed. And I appreciate that we're certainly not there yet, but that trajectory does not sound great. Dr. Hammond, same question to you. What are you all seeing right now?
Sure. So we're seeing basically the same thing. Mac and I talk, several times a week, and so we're always updated on what's going on. But yeah, I mean, I think Region 5 as a whole last Sunday had 23 hospitalized patients, and this Sunday, fast forward a week, and we've tripled. We were at 68. So I mean, you can see how rapidly it's climbing. We're at the same boat at St. Patrick's. I mean, we've gone from a handful now into the teens. And so we're seeing the same sort of things that he's describing in terms of the demographics. It's definitely a younger population, I think, both because that's where it's being spread and we have such a high vaccination rate in our nursing homes that we're not seeing, because that's what we saw early on with a lot of the nursing home patients and things like that. And we're not, at least here, we're not seeing that this time around. It's more of otherwise healthy people that are out in the community.
Thank you, Dr. Hammond. And sticking with you, let's get straight to the conversation about vaccines. I have tried to be very vocal about the message of visit with your doctor, visit with your medical provider. I would never fault someone for taking the advice of their medical provider. I can tell you that my doctor strongly suggested that I get the vaccine. I did it. My wife did, and many of my friends and family have received the vaccine. I had no side effects personally from the vaccine. But Dr. Hammond, I hope I'm not asking too personal of information, but have you received the vaccine? Are you generally encouraging others to do the same?
Yes, absolutely. I got my vaccine back in December. I've gotten my wife vaccinated when she was eligible. I've gotten my parents vaccinated when they were eligible. I would encourage any of my patients to get it and as soon as possible. I think it's unfortunate that this has gotten so politicized. A vaccine's not political. Medical care is not political. I'm an apolitical person, so it's important for people to understand that they need to have conversations with physicians and with medical professionals and to try and talk to people they trust and not rely on data that comes from the internet or from Facebook or something along those lines. I think that we've got a great group of physicians in our community, both in Lake Charles and in the surrounding areas. And so I think it's important to have people talk to people that they trust and get their advice there.
Thank you, Dr. Hammond. And look, I know this might sound a little ridiculous to say this, but I mean, I'm just going to ask you again, when you're making these comments, you have no agenda other than the health and welfare of this community. You don't get paid more, whether you vaccinate more people or not. Is that
Right.
a fair statement?
Yes, absolutely. No, we
okay.
have no financial incentive. I have no incentive other than trying to end this pandemic so that we can go back to normal and I don't have to worry about reduced capacity for LSU games.
Amen, Dr. Hammond. Dr. Jordan, same questions to you about the vaccine.
So yes, sir. I was also took the vaccine as soon as I was eligible. And also my wife, who has an autoimmune disease and who's immunocompromised. I felt strongly that if she came down with a virus, she wouldn't do well. So she too became vaccinated and did very well with the vaccine. Also, I had a daughter-in-law who was pregnant with twins. We had a very good conversation, and we talked about the risk benefit of her getting vaccinated. And she became vaccinated during, I think, her second trimester, had an uneventful delivery, at twin grandchildren. And so again, I strongly, from a personal standpoint, feel very strongly about the vaccine. To your point about the agenda, I think we do have an agenda. It's that we care about people. And this time last year, words like flattening the curve, we had no way of preventing disease. We were trying to slow the spread. But now, in 21, we do have a way to prevent COVID. And clearly, I think the vaccine has been given enough that we do feel very, very comfortable saying it's very effective. And the safety profile is very good. So again, we talk about risk-benefit ratio in healthcare, and clearly I think that there is hardly any risk at all getting the vaccine, but the risk of not getting it is huge.
So Dr. Jordan, what do you tell people when they ask, well, what about the side effects? Has this vaccine really been studied enough? Do we know what some of the downfalls are of taking the vaccine?
You know, I think certainly we understand why a lot of people have concern or confusion, but people don't realize this vaccine was actually being worked on. Messenger RNA introduction to the cell was being worked on in the 1970s. And then when we had the original novel coronavirus infection in 2003 that was termed SARS, there was work on the vaccine, a messenger RNA then, and also again in 2012. So this vaccine, this messenger RNA vaccine, has not been worked on just for a short period of time. It's been worked on for many, many years. Now, there was a unprecedented collaboration between countries, pharmacies, hospital systems throughout the world that got this vaccine to emergency use authorization. Rather than doing things in a linear way, like dominoes falling, things were done in parallel. So this time last year, these vaccines were going into humans' arms as part of clinical stage 3 trials. So we feel very comfortable we've got a good grip and an understanding of the adverse events. And what people feel is not really an adverse event, it's just the body's response, the immune response in forming the antibodies. So again, Nick, it goes back to risk benefit. I think there's no risk to getting the vaccine, but there's huge risk in not.
Dr. Hammond, I've heard a percentage of people that are actually dying from COVID-19 now, and how many of them have had the vaccine versus not. Can you comment a little bit on what your understanding of that is?
Sure. I mean, the data that we have nationally, and then it's reflected in what we're seeing in the hospital here locally, is that, in terms of deaths and hospitalizations, it's in the upper 90% of people that are not vaccinated. The vaccines are not 100% in preventing disease, but they do a very good job, even if they don't prevent disease, in preventing hospitalization and death. And so it's upwards of, in some cases, 99% of people, I believe, in the US that died in June were unvaccinated. And so it's a really strong statement in terms of how effective they are at preventing severe disease and death.
Yeah, I know that's a pretty powerful statement. 99% of the people who died in June in the US were unvaccinated from COVID-19, obviously. Well, gentlemen, I want to try to keep this concise as possible. I'll allow y'all to have any closing thoughts. Dr. Jordan?
You know, on the borrow a phrase from Dr. Hammond, he said last year, we're not going to vaccinate our way out of this surge, and we're not going to vaccinate our way out of this fourth surge. What we can prevent is the fifth surge, the sixth surge, and the seventh surge. And, if we don't reach a critical mass of vaccination, that's what we're going to be facing in the months, the years to come. So, I too, like everybody in Southwest Louisiana and Louisiana, let's put this behind us, and we know what to do. It's roll up our sleeve and let's all get vaccinated. So I appreciate you having us this afternoon, Mayor.
Thank you, Dr. Jordan. Dr. Hammond?
I would just echo what Max said. I think that, again, this is something that is so critical to, the coming weeks and months here in Southwest Louisiana and in the US. And so if we're going to get through this, it's going to be through getting vaccinated and getting enough of the population to where we can prevent more surges and hopefully get rid of this once and for all.
All right. So, ladies and gentlemen, I've got the vaccine. I encourage you to get it, but don't listen to me. Listen to these gentlemen who actually have medical degrees and a lot more pedigree than I have. So, Dr. Hammond, Dr. Jordan, I appreciate y'all. God bless.